Alrighty, hello everyone. Jess here.
Hi, Jen.
Hi, how are you all?
Good.
Thank you so much for taking some time out of your day to come on board and come along the journey with us as we try and help people in their homes, as I'm sure many of you guys are. And so I guess this is a really good opportunity, first of all, to let people know that this is a safe environment and that they are very welcome to ask questions. It's a very informal event, and we want that to be that way so people feel that they can really ask some of those questions that they have been having. And we had a wonderful event when we kickstarted this at home with QENDO last week, and the conversation was just so cool. So I'm really looking forward to getting into this with you all today. And I would like to introduce and welcome Dr. Bron Baillie, who is an osteo and an all-round amazing person. And also Esme Soan, who has been a backer of QENDO for years and an absolute amazing person in your own self and just what you've done in the women's health area as well. So super happy to have you both here, and thank you so much for sharing some of your knowledge and experience. So I guess I'd really love to start with just what's going on in your practice. What are people coming to you about? What are you finding? What are some of the key things that people have concerns with and that you're working through with them?
Do you want to go first, Bron?
Yeah, okay, sure. So, I mean, before COVID-19 hit us all, but which I have video consult if you need to talk to me, but with my practice, I mainly see a lot of women with pelvic pain that's associated with endo. I also treat lower back pain and just kind of the musculoskeletal components that are associated with endo. So I don't treat endo, just want to get that out there, but I treat all the kind of compensatory functions around it. So yeah, big one being pelvic pain would have to be what I see. And just women wanting some direction and some care around who to see, how to manage the pain, and kind of, I'm sometimes the last port of calls as well for women. It's quite interesting as an osteo, like I think because we're still getting out there in the community, but they've usually seen the physio, they've usually seen the chiro, they've usually seen massage therapists, and they're like, what is going on with me? And I'm like, well, there's a few things, but we just need to kind of work with what you need and what your goals are. So I'm going to stop doing that because my hands look giant. I'm going to stop that. But yeah, that's kind of what I see. What about you, Ez?
So I see lots of endo girls around, management of chronic pelvic pain. I also see them post-laparoscopy surgeries for a little bit of rehabilitation and safe return to activity and exercise. And then I also see them through like the fertility kind of journey. So we know that exercise has a really key role to play in management of hormones. So I sort of work with endo patients through those kind of different areas. So management of chronic pelvic pain and just general pain management, return to activity and exercise, but whether that's post-op or just wanting to get back into exercise that doesn't cause them to flare every single time. And then in the fertility journey as well. Most of my work as an exercise physiologist is in women's health, and that's a really big umbrella term. Women's health doesn't just mean pregnancy or just endo. So I see women of all ages at all stages, but predominantly I do see women's health umbrella terms of endo, adeno, prolapse, pelvic floor dysfunction. Then I also see pregnancy, postnatal recovery, and then oncology. I see a lot of patients in that sort of field as well. But in the endo journey, they're the three kind of main areas that I work with patients in.
And you both touched on something really interesting there. And I guess in this world now, we're seeing surgeries being cancelled. Some people might have had surgeries booked. Others may have been going through IVF. And what we're hearing is, and all of that really being put on hold, like a lot of things, what we're hearing through all of the streams at QENDO here, and I guess a few people here have said, what do I do? And so can you talk to us about, we know that surgery isn't the thing to do. We know that we need, and if you don't know, girls, listen, but we know that we have this MDT approach. You need a team around you, and here's some people on the team. So Bron and Ed, can you tell us and talk to us through some strategies on people who feel like that's on hold for them? What can they do at home? How can we start to use these next few months as an opportunity rather than, you know, a big pain in the uterus? Haha.
I like that. Well, I think for endo women, and just women in particular, we have to, and I put my positivity hat on, but we have to take this as an opportunity to actually start to get to learn more about our bodies. We have to become more attuned to what's happening, rather than just the site of where you get pain. My job is to make people understand how that pain is impacted through movement, and how, you know, walking a certain way or sitting a certain way can impact on that pain. So we have this huge kind of quote in osteo that stasis is the basis of disease. So if we're not moving and we're not kind of consciously aware of what's not moving and how we can make that better throughout our bodies rather than just the side of pain, then that's where issues start. And that's where I see people coming in going, I'm really stiff through my hips, I'm really stiff through my lower limb, like what is happening? Is this my endo? I'm like, well, no, it's actually an impact of how you're coping around the endo. So I think this is a really kind of opportune time for women to go, okay, well, I'm going to start implementing little strategies every day to get some more movement in areas that, you know, can impact on that one little bit, you know, through the uterus and through endo areas and through the abdomen. So for me, it's about little tiny strategies. Like I mainly deal with myofascial release stuff in clinic. So getting you to do some fascial release at home is a really big one.
So hold on. What's that? I don't know what that is.
That's okay. I'm gonna go through it.
All right.
So fascia is a kind of connective tissue. So it's really thick and fibrous, and it sits over the top of our muscles and it wraps them around. So it's kind of like cling film around like meat, basically. And it restricts it. But it's there to absorb force. So when we walk around and we do activities, it's there to kind of help take the force away rather than it going straight to our spine and straight to, you know, other areas that can't handle it. So when I talk about yes, she's got some fascial rolling stuff. Yes.
Okay.
So our job is, and what I see is people with myofascial restrictions. So for example, plantar fasciitis or things like that. So, and that's kind of, I see that a lot in endo cases of being really, really tight. So it's a really good start every day to think, how can I release my fascia and get things sliding and gliding really well? Rather than going, I'm just going to stretch my lower back. It's like, well, let's try and do a bit more of a structured approach to it. So it's also with fascia, it's our first line of defense in the immune system. So it's actually number one. A lot of people think, what? But it helps circulation, it helps lymphatic drainage. So it's super important to go and have some awareness rather than just hips and pelvis. Well, what are my feet doing? Actually, my right one's really tight. How do I feel through my limbs? How do I feel through my arms and my upper back? So I want you to have a little bit more awareness around disruption and restrictions in other parts of your body to see if we can make an impact. And we do that. Yeah.
Bron, what I love about what an osteo can do is, I've come to you before and gone, I have these really weird things in my neck where it's like kinking, and you're like, oh yeah, let me sort that out, you know, and just the weirdest body aches, you're like, oh yeah, let's just have a look. And you just, an osteo is such an amazing part for your toolkit, because you just work differently to that of a physio or an exercise physiologist. You all work together very well. Like, I mean, look at Ed, you just was straight onto that with your next strategy that we want to you know, we want to know about. That it's you know, and I hear these girls and women and anyone with endo say, I have this weird thing in my left arm on the third day of the month every month, and you know, no one can really tell them, but someone like an osteo can help you understand how and why that's happening.
Absolutely. We're pretty unique in just the way we're able to think about a problem. I still use similar techniques to a physio or a chiropractor. We're all manual therapists, but it's how we actually apply what we're doing to you. I don't have a protocol for you because you're not the same as the person next to you. You've got a different problem with different wellbeing goals, and I think that's what really separates us. It's not so much our hands-on techniques, it's actually how we think about the problem. So that's kind of a good way to put it.
I am also a huge advocate for osteopaths. Bron is my osteo as well. But for that very same reason. So, you know, exercise physiologists, we often get loads of questions like, what's an exercise physiologist? Even our title can be quite intimidating to someone. No, I'm not going to be getting you doing burpees. I'm not anything like a personal trainer. I'm an active therapist. So as Bron was saying about, you know, chiros and physios and osteos, we know women's health physios are a massive part of the multidisciplinary team for endo girls. So we love working with the women's health physios, but where the manual therapists are kind of this much hands-on therapy and a little bit of active therapy where they may give you some exercises or movements to do, I'm the opposite. So I'm this much hands-on and I'm this much exercise prescription. So I'm like the flip side of the manual therapists, or I won't touch you very much at all, but I'm going to give you loads of exercises and movements to do as part of your prescription from me versus the manual therapist. So that's why exercise physiologists and osteopaths have such a beautiful love story, because we both look at the body in the same way. So we're both looking at the whole body. How is this affecting the whole body, not just your pelvis? So we very much get out of the pelvis. We're not like women's health physios where they're just looking at your pelvis and your pelvic floor. We're looking at what's happening all the way up and down the chain, and how do we then help with that funny pain that you're getting in the side of your neck, or that restriction through your arm. Okay, well, what does that mean for the whole chain all the way down? Oh, what's happening at your hip? Let's do some stretches down here. And that's going to then have influence all the way up into your fingertips. So
yes,
we work really well together. Like, working together. And as Bron was saying, you know, it's really helpful having that hands-on treatment from Bron, because her fingers, her thumbs, her knowledge and understanding of your body is a lot more specific than I can get with my spiky ball. But we can then help to continue the treatments, the hands-on release and manual therapy that you've had from your osteopath. We can help support that with ongoing techniques that you can do for yourself at home that I can teach you with my myofascial release tools. So everyone's seen a foam roller before?
Yeah.
When we talk about fascia and myofascial release, that's what a foam roller is. That's what a spiky ball is. It's just a fancy way of saying release, like muscle release tools. So that's what we're trying to achieve when we get you to do your foam roller work or your spiky ball work.
What do you do with it?
Depends. What are you doing with it? So we love the spiky balls for release around the pelvis. So we do lots of gluteal release kind of work with the spiky balls. We can release underneath the foot. You can give yourself a nice little massage through your lower back, through we call it a thoracolumbar fascia. So when we get really tight through here, through the lower back, or even just all the way through your lower limbs, we can use the ball to help give you some gentle release with some exercises. So, for example, a favorite one is just straight underneath the foot. So if I jump back, take it off like a ball. Can you see me back here?
Yep.
Yeah. So literally pop the ball underneath your foot and roll it around. Feels really, really nice.
And just while you're doing that, I'll just pipe in, because with plantar fascia, it's kind of like, imagine a trampoline. So underneath your foot, it's like that, okay? Typically in women with endo, it's quite tight, so it's quite flat because of what's happening through the pelvis and how we walk. So it acts as like, it's meant to be a little trampoline that does this when we walk. When it's tight, it's like this. It's got nowhere to go. So we're walking and it's not absorbing well. So that force comes up to the lower back. So when we're walking, we get that restriction and pain in the lower back, hips, pelvis, knee, instead of where it should be absorbing through the body. So that helps release it so it becomes more like a little trampoline. I just want to pipe in.
And that's such an easy thing that people can do in their homes right now.
So good. I give it to people that sit at work on their office, like at their office. It's easy.
Yeah, absolutely. And with all these big changes with COVID, everyone moving to telehealth, we're the same here at PAIR. We've moved to telehealth appointments. We do still have in-studio appointments available after Easter, but there's so much that we can do over telehealth, just like this. It's like a Zoom call. You can look at me, I can look at you, I can give you exercises to do, but the same kind of idea. So it's not a one-size-fits-all exercise approach. You know, everyone has their own unique presentation of their endo pain. Everyone's at different stages of management of their endo pain as well. So we can go through some questions. We'll have a look at the way that your body's moving. So I'll get you to do some little movements on the screen for me, so I can see where your restrictions are. And then I can give you little exercises to do. And if you don't have a spiky ball, if you don't have any equipment at home, that's really not necessary. There's so many things that you can be doing. And really taking, as Bron was saying, taking advantage of this time to start to establish some routines and some self-care around your movement and around your management of your pain.
So I think some people are, they might be working from home, or they may unfortunately have had to drop out of their work, environment. So I guess then you've got all this health on top of all of that. What is something that they could just start doing today just to help get moving? Can you give us some kind of tips or different maybe 3 exercises or 3 tips that people can just start to do today? They might have some time when they may have not, previously, and they're starting to be open to this kind of movement.
Mm-hmm. Absolutely. Well, I would say from an exercise physiologist point of view, there's 3 things that we're trying to get started, or that we're trying to establish to really get our exercise medicine approach. So that's the mantra of an exercise physiologist, is that exercise is medicine. So whatever we're getting you to do in terms of movement, we're really mindful of then how does that movement then change our physiological response to different things. So just like if you were to take a pill, that physiologically influences and changes things in your body. Well, that's what exercise does as well. So the first thing would be to try to reduce your pain. So better pain management or exercise tolerance. And that would be through some gentle stretches. So I'll show you a couple of stretches. I'll go back onto my mat in a second. So reducing that your brain's response to pain. So starting to improve your movement tolerance before you start to really feel those big pain signals. And I'll let Bron talk a bit more about explain pain and why your brain's involved in that, but I'll show you the movements. The second thing is we want to try to establish regular physical activity. So when I talk about exercise to manage hormones, it's great to be able to fit in some exercise here and there, but what we really need is a very well established, regular, moderate intensity exercise routine. So it's all about that consistency and building up that tolerance to a moderate intensity exercise workout. And when I say moderate intensity, everyone goes, is that when I've got to do running and burpees and stuff? No. Promise you, no. But moderate intensity is the level that we need to be working at to create those physiological changes and response in your body. So a workout like a yoga or a Pilates or even a swimming is lovely, low intensity movement through the body. That's definitely, we've got importance for those style movements and that kind of exercise. But to physiologically change those hormones and get that response that we want and we need to work a little bit harder. So that means we're working at an intensity where we're still able to talk, but we're not able to sing. So we're just at that level of breathlessness where you can still talk, but you're not going to start singing along to the radio. That's the easiest way I can describe a moderate intensity exercise. And it needs to be something that you like doing, that you enjoy doing, that you're going to do, because that's the biggest and most important part of this is the consistency in that exercise. So if it's something that you hate doing, that's not going to work. And I can help, as an exercise physiologist, help introduce you to different modalities of exercise and find the kind that you enjoy doing and that you're going to be able to maintain and continue and have that consistency in performing.
Yeah.
You touched on a few times just there. Can you just clarify or explain why and how does that help with your hormones?
Well, so from say an insulin perspective, or why it helps in endo case is that we want to try and reduce circulating estrogen a little bit. And so exercise, consistent exercise actually helps with reduction of that excessive estrogen. From, say, if I talk about a hormone that probably most people have heard of insulin, if everyone's heard of insulin, if we think of diabetes. So when we have that moderate intensity exercise, what happens to a hormone like insulin is that we actually help to reduce the need for that hormone and clear glucose that's circulating in the bloodstream out of the bloodstream, gets sucked into all of the working muscles to be used as energy. So we actually then reduce the amount of demand for insulin. So we can often see things like insulin resistance in with PCOS. And we can see insulin resistance in women who are not moving very much. If you have quite a sedentary lifestyle and you're not able to tolerate much movement because you're, in the fetal position for many weeks at a time, we actually help with reducing the body's, we help to clear that glucose out of the bloodstream without so much need for insulin. So if we have insulin resistance, that's okay. We're able to bypass all of that by just having that skeletal muscle contraction actually helps to then clear glucose into the working muscles. But this is why we are needing that moderate intensity of exercise. If it's very low intensity, if it's very light impact, then we don't actually get that contraction. We don't actually get to that level to physiologically stress those muscles or stress that system. And I say stress in a good way. This is a healthy stress that we place on the system to then have that clearance of the hormones and clearance of the glucose out of the bloodstream. So that's why exercise, and that's why the importance here is that regular routine exercise, because it only lasts for a certain window. So we have to keep doing it to keep that kind of tolerance up, if that makes sense, of keeping that excess hormone cleared away. If we do a little bit of exercise and we rest for the rest of the week, we go boom, back down.
So and also more prone to injury that way too, because you're having big gaps of not doing little tiny things to keep you moving. So that's where I see injuries. Yeah.
It's almost like you just have to take your garbage out every day. Exercise, just get rid of that. Let it build up again, get rid of it again.
Yes,
absolutely. And it's so much easier once you've established a bit of a routine, and to use this time that we have at the moment to establish that routine, it makes it a lot easier. Whereas if you take a couple of weeks off and then you go back into your exercise, and that's where a big part of my role of working with my endo patients is to help, you are going to get those fluctuations of pain throughout the month. You're going to get those changes. And my role is to help keep you moving. Even on those days when you're having high levels of pain, we can still do something. Something is always better than nothing. There are going to be days where you go, I just don't feel like doing anything. But to keep that little bit of movement, to keep that consistency, makes it a lot easier over the long-term, bigger picture of your movement versus, as Bron was saying, not doing anything, then trying to do something, then not doing anything, then trying to do something. Your body just doesn't work in the same way as if we keep that consistency of movement. So I did promise you some stretches. Do you want some stretches?
Yeah.
Would love
them. Okay. Let me know if you can see me. I can move my computer around. So can you see me here, girls? Or do you want the computer down or with that? You can see?
Oh, that's good.
I might just pop you down just a little bit so you can see me on the map.
Oh, there you go.
Ah, that's good.
Lovely. So all you need at home, don't need any special equipment, just a mat or something comfortable underneath your knees. Our first stretch here is just a good old cat and camel. So often this will feel really nice if you're feeling a bit stiff in the morning. We start with our hands underneath your shoulders, elbows are slightly bent, and hips are stacked over top of your knees. You take a nice gentle inhale breath, breathing into your tummy as we arch the back and lift the head. Also the stretch through the front of your abdominal wall. Now I'm very bendy, so it doesn't matter if your movements are only teeny tiny. I'm going to really exaggerate what I can do so you can see the movements that my body's doing. But we take a nice gentle inhale breath and we arch. And we take a gentle exhale breath and we tuck and we round the spine. The cat and camel movement. Arch and tuck. So this stretch is really helpful no matter where you are on your pain scale or where you are in your cycle. This is a really helpful kind of pain management exercise to have in your toolkit. Super simple, but super effective. The next one is an adductor stretch. So you're going to kick a single leg out to the side, still in that 4-point kneel position. And then imagine you've got a tail, you're going to take the tail up to the ceiling. You should feel a really big stretch with the inside of the thigh up into the groin. Really, really, again, very simple. And we take 3 slow breaths here. So every time you breathe out as you're doing these stretches, you want to take a big sigh noise. So you want to go. The sighs might seem silly, but if you're at home, on your own, doesn't matter. Sighs are really helpful in helping your brain understand that this is safe movement, not dangerous, helping reduce some of the pain that you might be experiencing. And then we swap to the other side. And then the last stretch around that pelvis is the hip flexor stretch. So we come up onto one knee, like you're about to propose. And we want to think about that tail again. We want to try this time to tuck the tail down between the legs. So I'm really trying to tuck my tail, bring my pubic bone closer to my belly button. And I haven't actually pushed forward at all. So you'll often see people at the gym doing these ones, these big hip flexor stretches. No. You're not getting any hip flexor in this. Most of the time you cheat because your body doesn't want to do it. So instead of leaning forward into that stretch, all we're going to do is we're going to think about tucking the tail underneath, really flattening that bum down, and you'll feel a really intense stretch through the front of the hip. So you'll get a better stretch just with that tail tucking motion than you will with a big lean forward motion. And then we swap to the other side. So especially as we're all doing a lot more sitting at the moment, we're sitting and working from home, or we're in those crazy, not very ergonomical workstation setups. I know I definitely have been this week. I've had my foot up on the computer, leaning on the chair in all sorts of funny ways.
Don't say that.
Shh, don't tell my osteopath. We want to stretch out through those hip flexors. So those 3 stretches, plus adding a walk. So see if you can walk for, 10, 15, build up to 20 minutes. They are the best exercises I could recommend to get started with that are going to work appropriately for everyone at whatever stage of your management of your endo you're at. But trying to walk every day, walking at a pace where you're able to talk comfortably, but you're not able to start singing, and to go through those 3 hip pelvic stretches, brilliant. That will really help get you started with some of that movement as medicine.
How often do you stay in each of those stretches for?
3 slow sigh breaths. Yep, so just count out 3 slow breaths. Big inhale, big exhale.
That's like 5 minutes max for the whole thing.
Yeah.
Super easy.
Super easy. And I would recommend even going through those, even if you've got quite a high pain scale, have a go at going through that gentle movement, working to what your own tolerance is of those positions. So like I said, I'm quite bendy, so I could do quite a lot of movement through those positions. But even if your movement's just a tiny little bend and arch through the spine, that's great. That's getting all those tissues moving. And then you might find that you're able to build on that as you're able to tolerate more of that movement. But yeah, super easy, little toolkit, exercises. Use them like, instead of maybe popping a paracetamol, try some heat, try some of that movement, and then review what your pain scale is doing and see how you're going. That's what I would recommend. Oh, someone's asking a question. Oh,
go for it. Can you see?
I can see part of it. Oh.
So the question is, Esme, what about Pigeon Pose? Is that also good for maybe those who have higher pain tolerance?
I love Pigeon Pose.
So why do you love Pigeon Pose?
I like Pigeon Pose,
yeah.
but there's a couple of dependents in that Pigeon Pose. So if you are a hypermobile person, which as you can see with my bendiness, I am a hypermobile person, Pigeon Pose is not awesome for the hips. It's better to have more of a controlled position for that external rotation and glute stretch. But Pigeon Pose, if you're able to, tolerate that, if you don't have those loosey-goosey hips that you are able to sort of slip in and out of the stretch, if you're understanding what I'm saying. So if I demonstrate pigeon pose for everyone who may not know what that is. So pigeon pose is where we bring the knee through to the front wrist. We bring the ankle across to the opposite wrist, and then we sit back into the stretch. So you can see how I've got a really big right angle through this hip, and my back leg is extended out. You can even come down in this position. It's a big lateral glute stretch. Because I have mobile, can go like this, whoop, and back into it. So I can dip in and out of it. Not great for my hip, because I have too much movement. I don't have the stability. I don't have, everyone's heard of the rotator cuff of the shoulder. Well, there's a rotator cuff of the hip, and mine's a little bit loosey-goosey. So if you have quite hypermobile hips, which funnily enough, some endo girls, you can be hypermobile and stiff. Bron, do you see this too?
All the time.
Hypermobile stiff.
Yeah.
It sounds like an oxymoron. Can happen. So we don't want too much of that stress then through that hip. So an alternative to pigeon pose, yes, definitely stretching through those glutes, super important. But if you're not able to get comfortably into pigeon pose, or if you have that loosey-goosey hipness like I do, another alternative is just to do a glute stretch in line. So crossing ankle to opposite knee, hold on to the other knee, and roll yourself down to get a nice big stretch through your bum. Or if that's not comfortable to reach through and hold on to the leg, you can do the same thing sitting in a chair. I've got one on hand. Here's one I said earlier. So we sit on the side of the chair, we cross ankle onto opposite knee, we sit up nice and tall, spread your sit bones out nice and wide. So move your fleshy parts of your bottom out of the way. And that will give you a nice glute stretch as well. It's a little bit more controlled, not as intense as that pigeon pose position.
Bron, you said that you love pigeon pose. From an osteo's perspective, why do you love it?
Well, I love it because personally I'm not bendy. So for me, it's like, but it's, for me, I think just in terms of opening up the hips and the pelvis, it's a really good stretch. I sometimes give it to people standing. So an elevated, as a little bit of a variation sometimes. Where it's just because I have a lot of women that, and especially me, when I first start out in pigeon pose, it's too intense. My hips are too tight. So I need to kind of level it. Yeah, that's exactly it. So I get them on like either a dining table or a little ledge and do it that way. And I like it because you can keep your posture, your upright posture, and really work on your breathing with that one as well, and just modify it with the pressure. But from an osteo perspective, I do like how it kind of, even with your back leg, you can really open up the anterior part of the hip as well. So it's kind of like a double whammy, but yeah, it's good. But only if you can do it, and only if it doesn't cause pain.
This is why we say, I know it can be super frustrating when you're like, I just want, like, tell me what to do. I just want some straight answers. And we're going, it's all dependent on how individual you are. But that's because it is. There's not one size fits all, sadly. If it was everyone had the same approach and everyone got the same thing, then our jobs would be a lot easier, wouldn't they, Bron?
And just so with the exercises, just from an osteo perspective, they're the ones that I give my patients as well. So just if I was to kind of put my osteo hat on, what I like about them is the fact that in your spine, you have junctional zones where certain segments of the spine meet the other parts. So where the neck meets the upper back, the lower back meets, the middle back meets the lower back, and where the lower back meets our sacrum, so our tailbone. So they're really big transitional zones through the spine, which are responsible for heaps of rotational movement. And what, cat, cow, even thread the needle to some respect, they really encourage big rotational movements and getting them moving in planes of motion around that area, so that all three are kind of communicating. So I like, as an osteo, to get women to do those kind of exercises because they encourage movement at those zones, so that in between zones are kind of going, well, I can move better now too, and the ribs can move better. So I really like cat-cow for that aspect as well, because it gets all three moving together. And when we think about fascia, it all needs to move kind of together. Rather than being really specific and really localized, it's good to do stuff like that first. Motion is lotion. Get it kind of all moving together.
Motion is lotion.
I'm trying to work as many funny things as I can at all at once. In through this whole talk.
All the cliches. All the cliches. Healing's not linear.
Yeah, there you go. What are some more? But yeah, so I think from a breathing aspect, because you were talking about the signing and doing the breathing effectively, I educate a lot on that because of the importance of our diaphragm. So sits under our breasts in our chest, and the pelvic floor moving together. So sometimes if you've got a day where you're in a lot of pain, the single best tool you have is to control your breath, is to do some breath work. And I'm not talking about the just like, it has to be really slow and controlled breathing. So breathing in through our nostrils, holding, and then breathing and sighing, because Ezzy's exactly right, our brain is understanding that the sigh actually means, oh, we're safe. We're in a parasympathetic state of the nervous system. We're in a relax and digest, or rest and digest, as people say. We're in that state. We're not in pain danger zone where inflammation gets pumped down to the tissue. So it's really important to kind of understand that if you're having a bad day, if you can just do some of the box breathing, so the breathing in for 4 seconds, holding for 4, out for 4, and repeat. If that's all you can do, and being in a little cactus pose, which is another one of my favorite to open up the chest and diaphragm. So it's just simply laying on the floor with your arms out like my little Mexican cactus next to me, and just opening up the chest and breathing and just focusing on that. On those days where you're like, I can't bring myself to do movement, I think that can still have such an impact on your pain and your fascia and your movement.
There's just a question here, and I don't know half of the words, but I'm going to have a go. Bron, what are your thoughts on the involvement of the pelvic floor, ellipses? Yep. Thank you. Uterine ligaments, etc., with endo, and how would you treat them as an osteo? Apologies, I don't know that.
That's all right. So I'm just trying to work this out. Okay, so as an osteo, there's definitely, I do a lot of visceral osteo, so hands-on gentle visceral techniques, so moving the tissue around, working with scar tissue and working with visceral elements. So I also do balanced ligament tension. So for uterine ligaments, that's what I do, to just gently release what we call uterine torsions or strains. So Caroline Stone, who's a great osteopath who wrote a book about obstetrics and kind of gynecology side of osteo, wrote really good kind of techniques around uterine ligament release. So I do a little bit of balance work with that. With iliopsoas, like I tend to look at its attachment, so I look at the lower back and look at how the lower back's moving and try to make an impact from there. The worst thing you can do is try and dig your hands and do a trigger point release on an iliopsoas on an endo woman, because they'll be like, ah! And you know what? Then the rest of the treatment, we just throw it out the window because they're in protective mode. So if you spend treatments with people, oh, okay.
It's just a definition.
So everyone knows what muscle is, yeah.
I was like, oh, that was a big one. Yeah, so yeah, in terms of pelvic floor, I do a lot of pelvic positioning releases. So finding what works for them and what is a more optimal position for their pelvis. And that's through a variety of different techniques depending on what they need. But I always am working within a tolerance where I'm kind of at the verge. I call it at the verge. You know, when you go to a massage and you're just like the whole time gripping onto the sides of the table and you're like, this is really good. This is really good. It's not good to be that person, but you need to be working at a level where you know change is happening at the tissue, but you're not fighting it. So when it comes to this kind of stuff, I do gentle work that seems to have a bigger impact because they're more sensitive and aware of that area. So we can't go in crashing and bashing around with heaps of adjustments and trigger pointing and all these crazy techniques. I use them, but for endo women, you need to really back it off. And I actually find it more effective to do gentle, or what we call indirect osteopathic technique, like balanced ligament tension, positional release, craniosacral in some areas, and yeah, BLT, which is not bacon, lettuce and tomato, but what are you doing? But yeah, does that kind of answer it? It's very positional about what works best for them in very optimal position of the pelvis stuff.
It's really
yeah.
There we
I
go.
knew it. I had an inkling. I had an inkling Brooke might have been. I was like, it's a very good question.
Thank you so much. No, that does make a lot of sense. And like I'm only 4th year, so I'm kind of just getting into the other side of things.
Oh, you're nearly done. You're fine.
Thank you.
How exciting.
just for anyone who's following all along at home, Brooke, who's asked the questions, is an osteo student. So that's just fantastic. Welcome, Brooke. Look forward to working with you in the future. Haha.
Yes, please.
Can we, so we, you know, at the beginning of the talk, we spoke a lot about how you guys work in other parts of the body and not just focus on the pelvis. Can we move to the diaphragm and the muscles around there? So, because we hear a lot of people that have this issue or tense or pain in their diaphragm, and they think, oh, I've got endo in the lungs, and often that can be true, but there also are other reasons for it. And I'd love for you to just talk a bit on how can we help to release that? What does that mean? You know, I know, Bron, you know, you've done some work on this before, and Esme, you've got some stretches that can help. So, and we're all very much sitting at the moment, a lot of us are, so that can really really enhance any tension that we might be already having experiencing underlining what's going on. Can we just talk through that if you don't mind?
Mm-hmm. Do you want to go, Ez, or do you want me to go?
I was going to say, I can show a couple of stretches that we, like some diaphragmatic stretches that we use, but maybe you could explain tension and what diaphragm is, and then I can show the stretches and work on that.
All right, well, let's do that if you say I must.
Okay, all right.
It is okay, Brooke, you'll get this, because as an osteo student, you will end up having a favorite muscle. Mine is definitely the diaphragm, because she's so cool. But the diaphragm is this big dome-like muscle underneath our chest, so underneath where our breasts are, in kind of that cavity where there's a little kind of dip, so underneath our like sternum. It's, you know, we've got our windpipe that passes throughout our major abdominal aorta, and our esophagus. So when I see a lot of women who are anxious, have reflux, like a lot of tension through that spine, it's because sometimes there is tension in the diaphragm. It starts out like this if we're chest breathers and constantly breathing in a sympathetic nervous system way, so in a very sharp, short, anxious way, and not parasympathetic, so through our diaphragm, then the diaphragm gets really used to being tight. In endo women, we spend a lot of time crunched over and hunched over, and then we go to our jobs or whatever, which might be desk work again. So the diaphragm never gets a chance really to expand and allow for that breathing to take place. And the impact that has on our abdominal viscera, so our organs in the abdomen cavity, they rely on some nice pumping action from the diaphragm. The pelvic floor needs some diaphragm breathing to allow it to kind of move up and down rather than being flat and tight. So
Piston.
Yes, like a little, that's what it needs to be doing. And when I see women with reflux and anxiety and all that kind of stuff, it's tight, it's not moving. So there are many reasons for that, but it's really important, one, to do things like junctional movement, like the cat-cow, because it's opening up that fascial line through the front of the body. So I want you to imagine a rubber band. We sit all day, or we're in pain that day, we need to kind of start getting that rubber band to expand from the front. So in osteo terms, we call it anterior fascial line, right down the center, and it's anchored. So if we're not kind of constantly opening up that front and getting comfortable with that, even just cactus pose breathing is a simple one where it's in a safe position, you're fully relaxed in bed or something, and it's just working on your breathing technique. So doing that little box breathing is perfect, and making sure you do the sigh so that your brain understands we're safe, no pain, we're okay. So diaphragm is my favorite because it's just got, I just love it. And because you can have such an impact on it. And if you are kind of comfortable, I usually give people a self-release technique for it. So, you know, like, well, you can show it, Ezzy, like a little mini self-release for it. if they're comfortable and it doesn't cause pain actually, and you kind of palpate it or touch it and feel like it's okay to do, then I really like to do that one too, because it brings that awareness from the brain to the tissue through your hands of what you're doing. So it builds this awareness around the tissue, which is important, because as endo women, we shut all that down a little bit and go, okay, that's the box of I don't really want to know about that. And that's fine. But actually it's more empowering to understand it and work with it. So I think, yeah, that's kind of the diaphragm. And it does attach to your back as well. It doesn't just float around in the middle there as this weird dome muscle that I'm talking about. It attaches to your spine. So if we're moving that spine, we're helping the diaphragm. You'll be able to take that breath in rather than going, why is this not working? Well, I'm trying to breathe and it feels tight and I can't do anything. It's because it probably needs a manual release, either from an osteo, doing exercise like Ezzy is going to show you, or a little self-release at home. Ta-da! Sorry.
Yeah, this is another reason why I advocate walking so much, because that's even the rhythmic kind of opposite arm to leg swing that we get in walking is actually really, really good for your viscera. It's really good for, you know, as you breathe, as you get a little bit more huffed and puffed on your moderate intensity walk, that is getting all of these things moving. Yeah. So it's like a big internal massage for your organs when you go walking. It's that simple. Yeah. So the stretches that I would show for the diaphragm, the first one is just a nice big stretch down onto the mat. I'm going to take my foam roller down with me. You don't need to use a foam roller per se, but just a little pillow or something to support underneath the knee. So I'll show you really quickly. So we're lying down on our mat. We've got our top knee up at 90 degrees and it's supported on the foam roller or on your big pillow. Both arms reaching down in front. I'm going to draw a big rainbow over the top of your head. So as we inhale breath, we try to trace the fingertips along the floor. Inhale all the way up. Exhale as we bring the hands open. So we end up in a big T-shaped position with your hands. And then we reach up to the ceiling and close back to the start. So inhale breath as we reach the hands above the head. Exhale breath as we wing the hands open. Up to the ceiling and back to the start. Does that make sense? Yes.
And then do you do the other side?
Yes, definitely do the other side too. I'll just show you one side. So I've just got that underneath knee supported just so I don't get too much torsion through the lower back or through the sacrum, supporting those knees. But it's as you reach up, we're stretching out all those intercostal muscles. We're stretching out through the diaphragm itself. So how Bron described it before, yeah, it's like an old-fashioned tailcoat jacket. So, you know, it attaches up here around the ribs, and then it has like a little tail that attaches down to the spine. So when we do those nice big reaching rotation movements, we're helping stretch out through. The other stretch I would support is, you don't have to have a TheraBand, but even just having like a jumper tied around the base of your ribs. Having something with a little bit of elasticity in is helpful though, because you can feel the pull and throw. So we wrap our TheraBand right around the base of your rib cage. So you should be able to feel right down the sides and feel those last few ribs. Encompassing those into your band, crossing it over at the front and holding onto it just gently. You take a nice big inhale breath, and the goal here is you want to feel your ribs pressing out and expanding into the band. So it's not just at the front, and of course if we're chest breathing, we won't feel the band move at all. So we take that nice big gentle inhale breath, breathing laterally out into the band. And as we exhale breath, we pull the band a little bit tighter. And we go again. So a big inhale breath. Now see, as I'm inhaling, you won't really see much movement if I come a bit closer. Let me pull that band a bit tighter. So the goal here is you won't be able to see, I don't think on the little screen here, too much lateral movement of my ribs, but you won't be able to see any of this. I'm not breathing up through my chest, I'm breathing right down into my rib cage and breathing laterally, and using the band or a jumper or something just brings that extra awareness as to where are you directing that breath. Are you breathing what we call diaphragmatically, or are you chest breathing?
And so with the resistance of the band as well, so in clinic, we get people quite often to push against us or form some sort of resistance. This is a great way for you to do it at home, because then the muscles can relax a lot more effectively, if you want to put it that way, because you're working against resistance, which is really good. So it's more effective than just stretching sometimes. That's good.
Yeah. So they're my two favorite diaphragm stretches.
Yep. Good. Love that.
Fantastic. So we have a question here. I'm a vocal coach and I'm loving all of these diaphragm stretches. Love that. One I teach my students is to lay down with their hands on their stomach and get them to breathe deeply and move their hands up and down with their diaphragm. I have one I've learned is to breathe everything out, then slowly breathe in with their diaphragm, top up with the lungs, then slowly let out with a sound. I hope this helps.
Beautiful.
Thank you so much, Casey.
That's beautiful.
A vocal coach, yes, you'd be all about diaphragm, Casey. Yeah, interesting.
That's good.
So we've done uterus, we've done feet, we've done legs, we've done diaphragm. What about our neck and our head? And I think it might be useful to touch on how exercise and all of these stretches can help with our mental health at the moment. Looking at the same four walls every day can be quite So can we just chat through that just to finish off the chat?
Absolutely. So we know we've got such strong evidence now that exercise is medicine for mental health outcomes. So anxiety, depression, and other mental health, schizophrenia disorders. We've got such strong evidence from research now that shows that exercise, physical activity, is a form of medicine to help with treating those. So 100% to get moving will really help change your mood and your mindset. It can be really hard to take those first steps to get moving. Trust me, an exercise physiologist, I've been at home all week. I've been sitting down in front of a computer to see my clients and patients this week, which is not how I would usually treat at all. Still very effective in getting everyone's exercise prescriptions done, but very different for me as the practitioner. And I do not like sitting still. So the best thing that I can encourage you to do is to have a look. So on the QENDO website, there is an exercise for endometriosis ebook that's free to download. Highly, highly encourage everyone to go out, grab a copy of that, because it does have some exercises in there that you'll be able to run through. Get involved with some live classes. So the reason that live classes are, so popular with everyone at the moment, and my practice is running some live classes as well in the mornings, is you have that accountability. So, usually I would really encourage exercising with a friend, but social distancing at the moment. So exercising social distanced with a friend, because then you have the accountability. So someone else, you've got to show up for. Same with why it's so effective to exercise with an exercise physiologist. I'm here waiting for you to log on, waiting for you to come in. And that can often really help just to overcome that initial, I've got to pull myself to go and do this exercise. Once you get started, and I say this to everyone when they come in, if they're having a high pain day or if they're just really not feeling it, I said, go through the first two exercises and then see how you feel. If you don't feel like you want to do any more, that's fine, we can stop then. 100%, no one stops, because you feel better as soon as you start moving. So I would encourage, have a look, join in with some live classes, have that accountability, got to be online at that time, join in with that community online. I would say, exercise with a friend. So whether that's, via a Zoom call and you decide to do some stretches or exercises together, or if you do go out in real life, keep your social distance and go for a walk together. That can be really, really helpful as well. Remember that you do still want to work, like I said, towards that moderate intensity exercise. And it sounds scary, and it doesn't have to be something that you do straight away if you're only new to exercise or starting to use exercise as medicine. But remembering that that is still something we want to try to progress towards. So there's always something that we can be working on or towards. Moderate intensity. It's not scary, it's not intimidating, it just means working to that point where we get a little bit more huffed and puffed, we get a little bit flushed. You'll feel so much better afterwards. Very, very empowering to go, yes, I did it. I did that exercise. Bron knows I've been dragging her walking, haven't I? I say dragging, not dragging.
It worked.
I took it. We went.
Just from an osteo perspective, so in terms of anxiety and mental health and so people obviously come into clinic and I do techniques and we go through the whole session with them. I do have video consult and can talk through a lot of stuff that can help you at this time as well. Hands-on is just this much. It's tiny. It's actually a lot of me doing this, and anyone who's had a consult with me, they're like, oh my God. It's just so much information because I want you to be able to self-manage rather than coming back all the time and going, I need you to help me. I need you to help me. No, no, no. I'm here to make a change, but you're here to implement that for the rest of your life. It's your body and you know it better than me. And one thing that I've been talking about with Ezzy is progressive muscle relaxation. So PMR techniques are huge. They are, you know, the evidence supports it for anxiety, reducing blood pressure, and just assisting with muscle relaxation. And it's something you can do at home. I have a little PDF on my website in patient resources, drbronosteo.com, plug. So on the little patient resources, there's a form for endo women about PMR, which is the fancy word for it. But it's just basically like a guided meditation, which is not woo-woo, but it's just, it goes through how to contract muscles and relax them by consciously doing it, by being really aware and moving up your body through from the feet to the calves, to the hamstrings, to the glutes, and just working your way up. It's a good way. Yeah, perfect. Thanks, Joel. But it's just a really good way to get overall muscle relaxation at home through your whole body rather than just that one spot, but the whole body, and having a bigger impact on your blood pressure, anxiety, overall mood. It's good to do just before bed. I often give that to patients just before bed to help settle them, because at the moment we're kind of all, you know, in our house and then going to bed and being like, you know, I need something to stimulate kind of my parasympathetic system, a routine to relax you. And that's a really good option to do. So there's an instruction on that as well. And there's YouTube videos that talk you through it. There's Headspace, Calm app, all of those talk you through progressive muscle relaxation, which I think is awesome for this period right now that we're in.
Wonderful. Girls, thank you so much. Is there anything else that you'd like to add as a final thought or comment?
No, I'm pretty good.
I'd just say, you know, if your laparoscopy surgery has been postponed or if your IVF treatments have been postponed, you know, it's not nice, obviously, but please do reach out. There are lots of places that are closed to face-to-face, but there are practitioners like Bron and myself who are still available online, and we can help during this time. So, yeah.
I think we all need to really stand up our toolbox and our healthcare team around us. And if you are if you do have that opportunity to do it, book them in every 2 weeks, so it's rolling, just even for a check-in to see how you're going, because we don't have co-workers to be around us for accountability. It's, you know, really coming back on us. And so if you can stand up your healthcare team around you, and they're putting in amazing ways, telehealth, phone calls, text, whatever, to help you do that, take this as an opportunity, guys. And it's you know, an opportunity for you to realize that that surgery isn't the only thing. Surgery does not always help with pain and the ongoing management. It can help with reducing and getting rid of some of the disease if possible, but it's that whole approach around you that you need to really get this disease managed. PCOS, adeno, endo, pain, anything at all. It's just so much about getting that team around you. So thank you all so much for being interested in sharing and improving your health. Thank you to those who have asked questions. That's just fantastic. And thank you to our wonderful, wonderful speakers, Esme and Bron. We so appreciate your time, and thank you so much. They're such simple tools that we can implement for just 5-10 minutes every day. So easy.
Thank you. Thanks, everybody. Sometimes the first step's just jumping on and learning about it. It's good.
And you did that. So now we're on to the second step. And that's doing what we just talked about. And we'll be sending some emails to you guys that have joined and attended with some survey, because we want to know if this was helpful, what else you need. So every week we'll be bringing these types of things with different people to get you through this time. And we'll share some of the, Esme helped us write that wonderful ebook, and we've got some resources from Bron as well. So we'll share all that around with you that you can start to implement. Take care, and thank you so much.
Thanks, everyone.
Bye.
Bye.